Health experts have been calling for caution in the implementation of the voluntary use of face masks outdoors. Let's follow up on how this policy has affected the country's COVID-19 situation. Joining us over the phone is PHAPI President Dr. Rene de Grano to discuss this some more. Doc Rene, good afternoon. It has been about 2 weeks since the government allowed the voluntary use of face masks outdoors. But what is this really like on the ground? Have you observed an uptick in COVID-19 admissions since then?
Well, admissions are not really going up. However, if you will note, all the cases, especially the total active cases, have increased. Previously from 20,000, now it's around 38,000. So we are seeing an increase really in the number of cases around 3 weeks after this pronouncement was made. Yes.
All right. So basically, you have observed an increase in cases, but the good news is no increase in hospital admissions. Dr. De Grano, what symptoms have you observed in the people that have been at least going to the hospital for COVID-19? And would these people be the ones who did not yet get their booster shots?
Well, most of these people, most of the people who are coming to the hospital usually and are admitted because of the positive COVID are people who have comorbidities, and these are some who are seeking admission in the hospital and we call this incidental COVID. There are a few who have not been with complete vaccination before, and they usually go into the severe and critical cases. And these are only a few. But we have observed that people who do not have complete vaccination are usually having more severe symptoms.
All right. On the back of what you just said, Dr. De Grano, what would you recommend in terms of masking up or the mask mandate? Would you say that it is about time to require masks outdoors again? Or do you think that keeping this policy of voluntary use outside is okay?
Well, even before, when this pronouncement was made, we think it was a bit too early to be relaxing on this mask restriction. But I think they have their own parameters in making that decision. Right now, I think when the cases are going up, I think it's about time to rethink of that policy, or maybe just try to convince our people to consider that it is their responsibility to keep themselves protected also. And in the same way, they are going to protect those that may be exposed to them in case that they are, unknowingly infected due to non-wearing of the mask.
All right, sound advice. Thank you so much for your time and your insights. Private Hospitals Association of the Philippines Incorporated President, Dr. Rene de Grano, over the phone. Thank you, Doc.